infectious disease studies has encountered many threats. The best known is certainly COVID-19. In this phase, we are witnessing the spread of Omicron subvariants. COVID is probably at its social end, but not at its epidemiological end. The pandemic has shown us the great advances that scientific progress has achieved, detectable by mRNA vaccines and antiviral drugs. But there is not only COVID, and specialists are aware of it. ESCMID is very attentive to the issue of multi-resistant germs. In 2050, according to the WHO, antibiotic resistance will be the leading cause of death globally, causing 10 million deaths. To promote antimicrobial stewardship, ESCMID has launched ESCMID. This is a clinical platform that develops a network between infectious disease centers to create a dynamic register of multi-resistant infections in Italy. Young specialists are already at work throughout the country. To fight the resistance of microorganisms to antibiotics, it is also important to strengthen the culture of vaccines, an extraordinary prevention tool. Vaccinations save lives. We have become aware of it with COVID. We see it every year with the flu. And then there are all the vaccinations to be implemented in the different age groups, vaccines for children and pre-adolescents, such as the one against the papillomavirus, vaccines for adults, especially for the elderly, frail, and immunosuppressed patients, pneumococcus, herpes zoster, meningococcus, and booster shots for tetanus, diphtheria, whooping cough. ESCMID dedicated the course promoted by ESCMID, Vaccination of the Elderly in COVID-19 Times, which was held in Venice in September 2022 to the theme of vaccines in the frail adult, an initiative to encourage research, comparison, and deepening through an international approach and the involvement of young people. Vaccination prevention is also essential for hepatitis B. In Italy, it has been mandatory at birth since 1991, and thanks to this, the virus is almost absent in the under 40 population. It is more difficult to deal with the other hepatitis. For HCV, there are resolutive therapies, capable of eradicating the virus definitively in a few weeks and without side effects. But the problem is in identifying who has infection but is not aware. Meanwhile, a new drug is available for delta hepatitis. New treatments are also protagonists in the fight against HIV, an infection that nowadays can be considered as a chronic disease. But early diagnosis and greater awareness are needed, especially in young people. The challenges of infectious disease are still numerous. Known and new viruses to deal with, such as West Nile, Zutu, or monkeypox, must be addressed, especially with climate change, which is bringing previously absent viruses to our latitude. Together with institutions, scientific studies, specialists, patient associations, and the business world, ESCMID is ready to strengthen the infectious disease network and face a new era of infections.